Our system is broken, and Healthscope and Brookfield, you broke it.
We're out here today for the community. Our community deserves better.
In 10 years' time, there won't be many nurses left to look after the current community.
We want to provide good care for our patients, and we deserve to be able to do that with safe ratios and a pay rise.
Today, Nurses and Midwives Association members walked off the wards, gathering outside Newcastle Private Hospital to send a message. And calling on its operator, Healthscope, to come to the table.
We're fighting for the women and children and families of Newcastle.
Patients deserve better.
They're seeking mandated staff-to-patient ratios, a 15% pay rise, 30% night shift penalties and improved leave entitlements. The 26-hour strike, the latest in a series of rolling stoppages at Healthscope hospitals.
Nurses at the troubled Northern Beaches Hospital have walked off the job demanding better pay and conditions.
Staff at the privately operated facility are seeking a 15% one-year wage increase and mandated nurse-to-patient ratios.
It's not like a normal private hospital where people go in to get, elective surgery done. It's full of really, really sick people.
They arrive acutely unwell, frail, aged, with complex conditions, unstable, actively bleeding, in cardiac arrest, in handcuffs, in active labour. They are scared and we are struggling.
You are absolutely being stretched to the limit, burning out and being taken advantage of.
We're trained to look after patients holistically, not just tick boxes and get them through the system, and we just don't have the staff for that.
We've all felt the strain of making impossible choices with limited resources. When nurses are stretched beyond their capacity, when essential resources are scarce, everyone's safety is compromised. Our community deserves a healthcare system where quality is never a question.
We are working our butts off. We are on the breadline. Many nurses tell us that they are living paycheck to paycheck.
13% over 3 years. You're 16% behind Queensland. You do the same job. It's the same company.
When my son manages a pizza restaurant, he gets more per hour to do that than I do. And that's just grim.
We're not getting paid the same as public hospitals. We don't have the same entitlements as the public hospital, but we're offering a public service in our emergency department, so we should be having the same.
I work in ED and we don't have ratios, often managing 15 patients in the paediatric area plus the waiting room, 3 nurses. It's not enough.
If you want us to work like a public hospital, then staff us like one.
There's a public inquiry in 2019 into this hospital. We hear again and again that public-private partnerships should never, ever be implemented again in New South Wales for hospitals.
Health isn't a business, and both of us have worked in hospitals where health is a service, and health as a business just doesn't match up.
Public health and for-profit organisations are fundamentally incompatible.
They've come in to strip the company out, right? You're just an asset. You're something they can sell off. Well, you're not. You're worth more than that.
They're constantly telling us that they've got our backs, but we don't see it.
Something's got to give. I feel like I am prepared to sacrifice my payslip every fortnight if we need to go to strike again until we get things done and we get what we deserve.
We will not be silenced. Healthscope, get back to the negotiating table and sort out your mess.